welcome back to the We Age Graceful podcast. Y'all, we are rolling them out. I'm feeling good. Today makes my 7 week post op of my hysterectomy. So I was like, let's just talk about it. Because when we had the previous episodes, I was like so into it. I wanted to share so much. But I'm here now. So let's just do it. Let's just do it. So let me open up my little notes here, get it together. So I just want to talk about navigating through a hysterectomy, the pros and cons, and the benefits. There are a few. But before we get into that, how is everyone doing? What is going on? How have you been enjoying your weeks and your days lately? We're gonna get into a lot of self care talk later on because you gotta check in every now and then. You gotta check in, especially moments like this. I can speak for myself. Going through a hysterectomy and all the things. The highs, the lows. All the things. But before we get into the topic of today, I gotta plug my beauty and lifestyle channel. If you're into makeup, simple things, nothing crazy, things within age range. I am a makeup woman, girly, however you want to call it. I love playing in makeup. Okay. And I do have a beauty and lifestyle channel. It's called I Am Keli B. It's just me. And I just do simple everyday makeup looks over there. Things that are, you can do. Nothing where you have to have technique skills. It's just pretty much learn your face, put some makeup on to enhance what you have. In addition to that, I started 2 new series on my channel. One is Aging Graceful Diaries, kind of piggybacking off the podcast. And that's just pretty much, getting into routine. Sometimes they work, sometimes they don't work. You just, as you say, get in where you fit in. Sometimes we can start things they don't work and we gotta start something different. It's okay to start over. It's okay to start over multiple times. It's okay. Nothing in life is perfect. You make things the way you want to make them. And it's just pretty much sharing me, my routines and things like that. And then to inspire you to have your routines and what makes you happy. And I also have another series I started, which is called Life in My 40s. So it's just regular stuff because it's so many people on YouTube and you can go up there and do day in a life. You could do all these different things and you could find some woman in her 20s, some college kid or something, but actually find someone you could actually relate to, because I mean, not for nothing. I will lie. Well, I know for me, I can't speak for everyone. I'm kind of chill. I'm kind of routine but it's still good to see that there's someone else out there that's just chill, just like you. So that's why I created those 2 series, just to kind of like, bring women in and let them know that, we're here. And we're thriving. We're thriving. So let's get into it. I have here, I did a little outline just to make sure I covered all the points that I wanted to talk about because this topic right here is very niche. It's very to the point, but it can go left, right, up, down. Because when I decided to get a hysterectomy, like I really wanted one years ago, but the doctor that I saw, he was like, no, and he was like, you're not married, you don't have a boy, and all this other nonsense. And I was like, I'm not gonna let no man tell me how to work my body and what I want to do. I'm done with childbearing. You know what I mean? And it's some women who don't even want children. You know what I mean? It's some men who don't even want children. So how are you gonna sit back and just tell me I can't get it done? So that's when I went through with the ablation. I had 2 of those, and it's so funny because now the way I feel, like the way I feel about, I think it's called mymectomy. I think that's what it's called. If you go get a mammectomy, you get an ablation, they're like hand in hand. You're going through more. I can't even explain it. A mammectomy is a little bit more like it's like a hysterectomy, if you will, but you're just going in, taking out the fibroids and cleaning up the uterus to make it to where if you want to bear some children, you can still bear children. That's something for women who are in their childbearing years. But all of it, you still going under, you still coming out with a days. It's like, but if I would have had a different, if I would have had the doctor I had now, I would have had my hysterectomy probably 6 years ago, 6 or 8 years ago, 2018. I would have had it back then. But things happened the way they did. So let's get into the different types of hysterectomy. Okay, let's get into all of that. You had the total, which what I had. You had a partial, and we'll get into that. And then you have the radical. So total hysterectomy is when you get your cervix, the uterus, and the fallopian tubes. That's a total hysterectomy. And you're leaving your ovaries behind because they're still good. You want to get your hormones in check, and you just want to balance out. You don't need any extra estrogen patches or anything like that, shots, pills, creams, whatever the case may be. A partial, from my understanding, is just removing the uterus. That's it. Because if you, or you can remove the cervix. I'm not too sure. I didn't do my research on that, but I know for sure the uterus is gone because you still can't bear any children and you still won't get your menstrual. Radical, from my understanding, is when you remove the actual ovaries. I'm getting stuck here. You remove the ovaries. And you remove something else as well. Because some people say total hysterectomy when you remove the ovaries as well. But I got a total. I still have my hormones. And I'm not on any estrogen. I'm not on any patches. I still have my ovaries. And I'm pretty good. I'm pretty good. I'll get into that more about how I'm feeling and all the things. And later on down the line, as I get past my, say, 3 months, 6 months, maybe even a year, I'll get into how it feels to just be maneuvering through life without a menstrual. Because, you look for that sometimes, especially someone like me, you look for that because you go, oh God, I might, have that twice this month, whatever the case may be. So now we have to define the types of hysterectomies. What are some of the common reasons to get the actual procedure? Now, mine was for fibroids. I had several, tons of fibroids. I had a ton of them inside of my uterus. Like me having a child, if I was, able to, the child wouldn't even made it because it would have suffocated. I'm most certain. I don't know if that's even a term, if it's possible, but the way my uterus was impacted with so many fibroids, it was unbelievable. And the pain. Yeah. So fibroids is one. Again, I had tons of them in my uterus and I had them outside my uterus and they were in the lining of my uterus. So just imagine a uterus and you have a fibroid hanging out in the inside, but it done oozed out. Y'all. Endometriosis. That is another reason to have a hysterectomy. And cancer. Unfortunately, cancer can definitely get in the uterus, fallopian tubes, cervix, and ovaries. And since I had my fallopian tubes removed, what statistics say, there's all these fancy words here. They say that normally ovarian cancer starts in the tube. So if you remove the tubes, the chances of you getting ovarian cancer is slim to none. So that's good to know, but there's always that 1%. But you have to still have to get your body checked out. Still go, you're not having a actual Pap smear. The Pap smear is for the cervix to check for the cervical cancer, versus now you're just getting a pelvic exam to make sure the health of your vaginal area is good. So that's a good thing, because it's definitely a different feel. Because I had a pelvic exam on my 4-week post-op, and I mean, you get it when you get your pap smear, so you know what that feels. It's just two different brushes, if you know what I mean. So let's get into the benefits. The benefits of having a hysterectomy, y'all. I don't have to look at my notes. The fact that I feel lighter, I'm not as cold as I was before because I bled so much. That was a driving force for my anemia because I could never get my hemoglobin to be above, or yeah, like at 11, it was always below. And people say 8 is fine, but I was below the 8. It was bad. It was bad. But let's get into it. The relief of chronic pain and heavy bleeding. Can you imagine bleeding so much? You're just so moist down there and it makes it like a raw feeling. Have you ever experienced that? Like, treatment, prevention from gynecological. I just mentioned about the cancer. So you don't have to worry about that because that area is pretty much gone. You don't have to worry about, you can get cancer, can jump anywhere in your body, but you don't have to worry about having cancer in your reproductive area, in your woman area. It just improves your whole quality of life. I feel like I am just so airy, if you will. Not because that whole thing is gone, but I just feel good. I feel like sometimes the anxiety, the depression, the knowing that your period is coming again and you don't know how heavy it's going to be. You don't know the pain level you're going to have. You don't know how many pads you're going to go through. Can you even go out to dinner? It was to the point like that for me. I remember when I was in New Orleans last year, my period didn't come for 2 months. So it could have came any moment. And I went to a white party. Talking about the anxiety level that I had at that party. I just was like, let me just have a couple of drinks. I was feeling very tipsy because I was just like, I can't. But I didn't want to be too tipsy, but I couldn't focus and pay attention to if my period did come. Because the way my period came, it was gushes. Gushes. I mean, it was never like a little faucet turn on. It's like a gush and clots and everything. You don't have to worry about that no more. You just feel good. I can wear white now. I can wear cream. Like I bought this outfit. I've only wore this outfit in a reel that I made. I have on an outfit now. Those are for you who are listening. I have on an outfit. I just had to sit back and think about it. I have on a outfit. It's a cream outfit, a two-piece number. I never wore this outfit because it was light and I was scared if I wore it outside, something would happen. I would have an accident. And it's like now I'm going through my closet, things that I purchased 2, 3 years ago that I can still fit. And I can wear them with ease and don't have to worry. Like this past weekend, I went out and I wore a yellow sundress. And I was just like, I feel so good. It's like I'm not even looking for that thing to come back. I just want to have a nice quality of life. You do the simple things, the little things, the little things. And like I'm just mentioning, you just feel positive. You just feel good. The little things just make you feel good. So those are the benefits of having a hysterectomy. I know you may say that's not a lot, but if you're going through the bleeding, the fibroids, if it's cancer, if it's endometriosis, it's all those things that you have, in your woman area. You want it gone. You want it gone. And then if you're having so many issues and it's preventing you from even having a child, it's like, why do I need this? Why do I don't even need this to live? This is not one of my major organs. It can go. But there are some drawbacks. There are some drawbacks. Now, one is an irreversible infertility. Once this is out, you cannot have any children. That's why they have that procedure, mammectomy. If you just want to go in and see if you can try to preserve your uterus so you can have some children. There are surgical risks, where your body is being exposed. You can have complications. I'm very fortunate that I had a very good, successful surgery. Everything went well. You can have long term hormonal effects, just your body, the estrogen and things like that. That's if you get your ovaries removed. Now, I'm not in menopause yet. I will definitely go through menopause whenever that time hits me because I can start in my 50s. I can start, later on. But right now, am I experiencing some perimenopausal stuff? Absolutely. Absolutely. I'm experiencing all of that. Any emotional, psychological impacts, because, especially if you're a woman who wanted to have children and now that you had to get this removed for health reasons, absolutely, you're going to feel some kind of way. You can go through all kind of emotional feelings. The only emotional thing that I'm going through right now is that I am happy, okay? I'm going to be 48 next month. And the last thing I'm thinking about is bearing a child. Now, I understand that I am older, so I'm not someone in my 20s or 30s, even early 40s. Even someone who are in their 40s who want to have children. Women, we have, I hate to say the biological clock thing, but sometimes you can have healthy children, late in life if you're still ovulating and all those things. But there's so many risks with having children later on in life. There's so many risks, and we're not even gonna go there because we're focused on hysterectomy. Okay, now, are there some alternatives to having a hysterectomy? Absolutely. I had one of them, which was the ablation. There's medication, there's all other treatments that you can have, but those two are the main ones. You can go on medications, you can have, like, I think, yeah, birth control. If you're bleeding heavy, the birth control can kind of make things a little bit lighter. But again, there's some effects with taking birth control for years. I do know of a woman who taken birth control for long term, and then now it's time to have some children. She's ready, and it's kind of hard. So that can be something. So in addition to other alternatives, before getting an actual hysterectomy for whatever the needs are. Always understand, once you get a hysterectomy, that is it. The shop is closed. There's there's no more. Like nothing's going on. So, talk to your healthcare provider, on the options that you may have and what may fit your lifestyle best because we're all different. We're all different. And go from there. But I do have on my channel my whole hysterectomy journey. I have not yet posted my 4 week post-op appointment video, so that will be up soon. If not, by the time you hear this, it'll be up already. Go on and check it out. If I can, I will leave it in the show notes for you to go check it out. I'll leave it in the description. Wherever, where I am, I'll have something there. But just to kind of, go through some key points, having a hysterectomy is not the end of the world. You can have a quality of life. Like, I am so ready for life after a hysterectomy. I'm so ready. I'm so ready to live life without knowing that I don't have to worry about doubling up on any type of I just can't doubling up on pads, tampons, anything like that because of the flow. I don't have to worry about that. So, just understand what your options are, your benefits, the drawbacks, the alternatives, and have a support system. Have a support system. I really didn't talk about my hysterectomy with anybody. I just pretty much just started making videos about it. It's good to have a good support system, and I had my immediate family to actually be there for me. I have two daughters. My daughters were here for me, and I got through this whole process smooth. I'm grateful, and I'm just ready for the next chapter. And if you have any questions about hysterectomy, what I went through, you are definitely able to leave it the comments down below. We can have ongoing conversation about it because this is something that needs to be talked about amongst women because we go through so much. We go through so much. So I am here for you to talk about hysterectomy in addition to You can go on over to my main channel, which is on YouTube. It's called I Am Keli B. And you can definitely see from the beginning to where we are now. And I'll definitely keep you up to date on how I'm doing in 6 months and how I'm doing in a year. If anything, wonky came up, I'm definitely going to share. So I want to say thank you for listening. Thank you for being here. And I will catch you in the next episode.